very well, far better than it was under the NDC. There are lots of things they say they have done the most of in the history of this republic. So then, if they have done everything, what do you seek to do? What's your basis for even drawing up a manifesto in the first place?
Okay. Interesting. Sometimes, communication, those of you in journalism and in the sphere of communication, communication is a very powerful tool. And sometimes you can be very lyrical to the point that you can convince people to believe what is not as it is. And I think it's one of the pluses for this government and its communicators. But this time they have a daunting task.
An ability to convince people.
To convince people. I mean, so that you are very hungry and they tell you are not hungry. Students are starving and they tell you we have fed them. We have a free SHS, which in my village, some people call it a SHS because you are there and you are hungry. You can't even study. Malnutrition is the order of the day. And yet you are being convinced. And then they come and throw figures around, statistics, all of that. But you see, when it all comes down, it comes to the individual. What do you feel? And we can match them on the figures. And then you realize that it's just empty barrels, let me put it that way, making a lot of noise. So if you take the health sector, if you look at what we left for them, it was significant. We had a situation where His Excellency had constructed the University of Ghana Medical Center with 617 beds then, the Tamale Teaching Hospital, 800 beds, in the phase 1, 400 beds had been supplied. That's infrastructure. The Rich Hospital was there, Bolkatanga Regional Hospital, and many others. In fact, at the time we were leaving power, we had constructed 59 hospitals and polyclinics, 18 health centers, 1,260 CHIPS compounds. And these were CHIPS compounds completed by the money of employees or appointees of His Excellency when he decided to slash their salaries and use it for that purpose. All right? That's just in infrastructure. We had a system where people were being recruited without enrolled into health training institutions without capping. And when the numbers were challenging and were discussing nursing training allowance, they used it against us and promised the people nursing training allowance. They will restore it, they will do this, they will do that, they will do that. And I keep telling people, whenever the NPP government or party gives you something with the left or the right hand, be careful. Because they'll come for it 10 times more or tenfold with the left hand. So, and a clear example is this issue of the nursing training. I will show you a document here where after we had said that, look, if you don't manage this nursing training allowance, you're going to have challenges with the admissions. And they promised it publicly. Then in the background, when they restored it, what did they do? They put a quota, which means that some schools were admitting less than 50% of their capacity.
Okay.
Right? You could admit 200 students, but you are instructed to admit only 100 students because of allowance. So now many more people who wanted to access this training in schools could not get it. And then you are there, and the few that were even there were not being paid. So in terms of what we left behind, in terms of health infrastructure, it was significant. I've mentioned a few hospitals. In terms of human resource, we were doing excellently well. The brain drain was on a lower scale. There was hope restored to this country. People were trying to stay and learn and practice here. Currently, the health sector is in a very terrible state. And I'm not the one to pass the verdict. The data is there. The service indicators are there for us to see. But let me take them one by one, a few of them. And then you now see the basis on which the NDC is making some promises. If you take healthcare infrastructure, I've just told you the number of hospitals we built without creating slogans, without sloganeering. If you added the number of hospitals we built and bigger hospitals like UGMC, we built the first quaternary hospital in this country. We built important hospitals like IMA, the International Maritime Authority Hospital, the Rich Hospital. We didn't do sloganeering with them. Someone comes with a beautiful slogan, Agenda 111, and dot hospitals all over the place, and are struggling to complete just one. All right? The difference between the NDC and the NPP is as clear as darkness from light. And I'll give you another example. When we were building UGMs, a visionary leader knew that we were building a quaternary hospital that we've never had one. When it was about to be completed, they selected doctors, nurses, sent them to Israel. My colleagues went to Israel to train on the equipment that they were going to use in this hospital so they can practice to proficiency. Bank of Ghana was almost complete. We went through process of recruitment to get quality staff to man it. This government came, threw everything on board, and you know they had to take demonstrations for them to operationalize UGMC. And what did they do? Look at it. No one was sent in for training. This Agenda 111. Ask the ministry or the health service to tell us their human resource plan. We're not talking about the figures of people needed. What have they done to get the number of people to man these hospitals if they had any plan of completing it and staffing it? If you want to staff it, you don't get doctors overnight. You don't get nurses overnight. So when they made that declaration, I made a call that can we see a human resource plan? Are you increasing intake in the nursing schools and earmarking some nurses to these specific hospitals? The constituencies or district where these hospitals are being located, are you granting some specific scholarship for people from there to go to school and come back and serve in these hospitals? Are you increasing intake in our postgraduate training schools? It takes 3 years minimum to produce a specialist. In some specialties, 5-7 years. Are you training more? Are enticing people to come and go back to these places? No. So we have these facilities dotted all around. No clear plan on how they are going to be equipped and how they are going to be staffed to operate. Okay. And then someone tells you, I've built the most. Where? Where is it?
But this staffing or human resource plan that you're asking for,
yes,
is that necessary? Because every day we have unemployed nurses and midwives and physicians and everything. Of course, for the Ghanaian, the human resource is already available.
Good. I'm happy you've come there. It's one of the areas where they've created a mess. So if you take nurses, I'll give you just the nurses. They did something in 2020, which they want to repeat this year.
Okay. From
2020, 2021, 2022, 2023 batches of nurses that have graduated from all the institutions, nobody is employed. Nobody.
From 2020?
Yes. Now, just recently, they opened the portal and asked people from 2020 alone to apply.
Okay.
They applied, gave them hope so they can vote for them. They are still sitting at home. Instead of giving them clearance, they've applied. Nobody has been posted, and they are still there. Not to talk about 2021, not to talk about 2022, not to talk about 2023. Mark my words. What's going to happen is that somewhere around November, December, they will grant clearance to all these batches of nurses sitting at home. 20s of maybe 20,000, 22,000, and ask them that they've been giving them employment. So they will come out and vote for them. They did that in 2020. And then when they came to power, they will tell you, oh, you've been employed, but it will take effect from January because they are uncertain who will win. So when they win, then they come and renegotiate with you that some cannot start now because of its impact on the wage bill. We have to manage it. And then if they don't win, then they've carried the burden over to someone else to look at how to handle it. That's what is happening. There's mass exodus of nurses and doctors out of this country. Unprecedented proportions. This happened some time back, and that was the time when the economic conditions in the country was terrible. We didn't have opportunities for postgraduate training. The Ghana College of Physicians and Surgeons was established, and then when the economic conditions in the country started improving, people decided to stay. I was part of the batch that many of us stayed. Before then, our seniors, before they graduate from medical school, the best graduating student, you will not even find him to take his award. He's already gone. But when they established this college, some of us took the option to stay here, specialize and train in this country and work. Now, Not young nurses are leaving on. The specialists, nurses, the specialist doctors are the ones leaving, which is a different form of migration. The earlier part is young people from school that were leaving. Now you have consultants, specialists leaving. Our most experienced staff are leaving.
Why?
There is lack of hope. There's increasing despondency. People are having no hope in the country. All right? I'll tell you, one of the time when they did this domestic debt exchange haircut, one of my lecturers in medical school was spotted at the finance ministry picketing. My classmate, my roommate actually, called me from the US and said, look, Titus, you are still sitting in this country. I said, why? He said, see our lecturer. After years of work, she's here begging for her medicine to buy, her money to buy medicines, medications to take care of herself, her own savings. You are still in this country. Really? Look, that singular act.
So you have classmates who are still encouraging you to leave the country?
Of course, that's what I'm saying, that the people who are moving, some are like my mates, and I'm a consultant. And people of my caliber are moving out. You know how many years it takes to train someone like me? After medical school, you need at least 5 years. In some instances, 7 to produce a consultant obstetrician gynecologist. So when you lose one of that, and you tell me that you have new doctors coming, it's not the same. But that act, that domestic debt exchange, haircut, created a mental scar on people's mind, and people have lost hope in this country. Coupled with the corruption, unbridled corruption, nepotism, people cannot see any future in this country. And so the middle class, people who have professions that are in high demand elsewhere, they're all leaving. So there's no hope. That is the problem. So this migration and this new dimension, I wrote an article called The Shifting Goalposts in the Brain Drain. Because then it was young people. So if you offer them training opportunities, they will stay. Now it's not young people. People who are trained to the highest level are leaving. So it's not about training opportunities anymore. How do we get them to stay? You have to improve the economy. You have to give hope to the country.
So linked to even addressing some of the things you're saying,
yes,
is the state of the economy.
Yes. It's a critical thing. Because if you cannot invest in anything, people are holding back. What is going to happen? So if you have any means of moving, you move. So that is the kind of healthcare system that these people have left for us. Human resource-wise, it's terrible. Most of our experienced people are leaving. And now, the irony is that you train these people, and because you know you cannot employ them, you pay them allowances while they are in school. They finish, they are not under any bond. So anybody who wants them can take them. And nothing is paid to the government. Nothing is paid to us. Rather, private agencies that help recruit them are paid. So you train people with taxpayers' money, and they are free to go anywhere.
They like.
And they get signing on fees, part of which goes to agencies, and nothing comes to the government. So why can't we control this migration? Why can't we have a system where even if you have excess of these numbers, you can have a planned migration so that countries that take these people pay something to us so we can train more? Because we have people that are jobless. So if you want to, it's a way of giving jobs to our people. Train more. Don't introduce quota systems. So we said we'll take off the quota system when we come.
Okay.
We said we are going to restore this nursing training allowance because we found that people need it. The economy is so bad. In addition, we even offer them student loan so people can train. Then you have a planned migration system. If you want to move out, there are channels through which you can move. And the people that hire you must pay something to this country so that we can train more people and improve our system. We also
So you're not going to touch the nursing training allowance?
No, we have stated it emphatically that, look, we are a government that listens to the people. If this is what the people want, we will have it.
You're ready to?
We're ready to maintain it. But in addition, we are going to take off the quota. This quota system in the admission means that so many qualified people are sitting at home. We are going to take that off. We are expanding health infrastructure so that there will be more places to employ these people that are coming out.
Agenda 111. 111 hospitals. That's a significant number of hospitals.
I didn't want to go into the details of that. I have asked that let's wait and see how many of these hospitals they will finish. How many?
They'll finish by what time? Now? Or?
Yeah, I mean, you see the changing timelines, isn't it?
Yes.
They started, it was 18 months. It never took place. It's been more than a year, now 2 years. When are they finishing? And it's not about finishing. Of course, for the sake of election, they will push a few people to maybe finish some and then they'll go and just commission them and all of that. When we say finish, completed, equipped, staffed, and people working in there. How many would they be able to complete?
That is when you say a facility is...
It's complete.
Okay.
And you see, that's what happened to our E-blocks. We built a certain number. We commissioned those that were ready for students to enter. Some were complete, but were not equipped. Okay. So we decided not to commission. His Excellency will never do something like that. Okay. John Dramani Mahama will not go and commission a facility that people cannot use. That is being a cruel host, giving people hope when nothing is there. You know, so they were complete, but waiting to be equipped before they commission them. But I can bet my last coin that these people are going to commission these facilities and they'll be standing there. It takes much more than the structure to operate a health facility. Okay. So this Agenda 111 needs to be completed. We need to find out their funding mechanism. Surprisingly, this thing is not even domiciled in the Ministry of Health. If you go to the Ministry of Health to ask for information, they have no information about it. Everything's
that the Ministry of Health.
Yes, everything's coming from the presidency.
Oh, it's a presidency project, not the Ministry of Health.
You are a journalist. You find out. Challenge me to this and find out.
Okay.
Find out how the contracts are awarded, who are those managing it.
Because before you construct a hospital, you must have basis for constructing a hospital. You must know where to site it. And this kind of data you can only find with the Ghana Health Service, the Ministry of Health. They do the groundwork. Oh, very interesting. Anyway, but so, now let me... Okay, so now let's come to which critical areas of infrastructure are you going to focus on?
Okay. So,
what are you expanding?
Great. So we have stated in our manifesto that when we come, we want to expand the infrastructure. And unlike what is happening where they are just doing sloganeering, we have done needs assessments. Okay. And on the basis of the needs assessment, we are going to put up some specific hospitals and upgrade others. So, for instance, we want to upgrade Kolebu to a quaternary hospital. Kolebu currently is a tertiary hospital. So, we want to upgrade it to the like of UGMC. Okay. It has a human resource to operate like a quaternary hospital, but the equipment, the space to operate is not there. Okay. We are going to upgrade Konfanochi, the existing teaching hospital, so they can function optimally. Okay. We've said that we are going to build a trauma hospital like that at Winneba, along the eastern corridor, to cater for that road. So the road crashes there, people can move to that place. We are going to do a 500 bed specialist hospital, children's hospital. Okay. When I will mention that, people say, oh, they are building something at Weja. Yes. That is almost like a polyclinic. That is what
is being built at
Weja. It's 120 beds. Okay. 3 theaters. Anybody who understands medical practice will know that hospital is just like a polyclinic.
120 beds?
Yes.
That's a lot of beds.
No, my dear. You have 120 beds, 3 theaters. We are talking about an ultra-modern children's hospital like the UGMC kind. Okay. You can find what we are envisioning in South Africa. There's a hospital called Red Cross War Memorial Hospital in Cape Town, in South Africa. That hospital, a lot of my colleagues in Kolebu and from Ghana go and train there. Okay. People across the region go there for training. In children's health, you see, sometimes we treat children like they are miniature adults. They are not. So we have a whole department on children tumors of their brain. We have a whole department on children lung conditions. We have a whole department on children's eye conditions. We have a whole department on children's urological conditions, orthopedic conditions. These are all fully developed specialties on their own that are supposed to have their own theaters to operate at that level. And for that kind of a hospital, that is what we are envisioning, that we are saying a 500 bed capacity hospital. that will offer high-level cutting-edge specialist training, research, and service delivery.
Okay.
It will be a source of medical tourism. Medical tourism is very high on our manifesto.
Okay.
And there are several parameters we are putting in place to attract this medical tourism. This is one of them. Okay. So when this facility is built, it will serve these purposes I have talked about, and then help with medical tourism as well. Okay. In addition to that, we want to add an assisted reproductive technology facility to it.
Okay.
So a fertility facility.
As part of that specialist hospital? Okay.
Now, this fertility one that we want to build, want to add, we don't have any government hospital currently offering fertility services at a high level like IVF because it's very expensive. Okay. So it is hoped, it is envisioned that when that is done, it will bring down the cost a bit for people, because at least the equipment would have been provided, the human resource would have been provided, and all that will cut down the cost of doing IVF. UGMC is trying to start one, but it's not there yet. So it is something that is not available. We have said that we are going to look at health training. So the medical schools, a lot of our people are going out of this country to train, come back and struggle to pass the exam. So in the Ahafo region, that's why I heard the report this morning. His Excellency has promised a medical school to be established there, and then use the Sunyani Hospital as a teaching hospital to train this. So that will cover for that belt. And we have the track record. We did the UHAS, and we are going to add 2 more campuses to UHAS in Bato and Keta to improve training. So we've done that. We are going to do a similar thing that we've done UDS, and it's helping improve the doctor-patient ratio in that enclave. So this would automatically improve the doctor-to-patient ratio in that part of the country. And then we have looked at mental health, upgrading our existing mental health facilities, Accra Psychiatric, Pantai, and then making sure that we integrate mental health properly into our health service delivery. And we always do holistic thinking. So we talk about the human resource. We said we are going to upgrade all our nursing training institutions into degree awarding institutions. And we've done that before with the teacher training colleges. And nobody takes that from us. When it comes to education, we haven't sung our praises enough, because all the public universities in this Fourth Republic are accredited to us. They've added nothing. They only come to rename. All right? And when we intend to do that, we say we are going to offer about 200 scholarships to nursing and allied health tutors to pursue PhDs. This is in connection with the transformation we want to do to their training institutions. Because if you are elevating them to degree awarding, they need PhD holders to teach in that institution. And that's why we want to do this, to make sure that it's a holistic improvement in our human resource. So we produce nurses of very high caliber for our market and for the international market as well. We have seen the impact of the Ghana College of Physicians and Surgeons. We've seen the impact of the pharmacists, their college, the Nurses and Midwifery College. Because of this, we say we are going to establish a national college for the allied health sciences. So radiographers, dietherapists, we want to establish a college for them as well. So these are some of the things that we have pledged in the manifesto for infrastructure and human resources.
I'll come back to one thing, because you are an obstetrician gynecologist.
Yes.
How big a deal? Because for you to have included the fertility, specialist fertility center, as part of that hospital, it means that, because you say you did needs assessment.
Yes.
How big a deal is it?
Okay, let me tell you one thing. If you go on our market today and you want to do IVF, all right, in vitro fertilization, it's mainly in private facilities. You are not going to get it anything less than, depending on where you go, maybe 65 to about 80,000 Ghana cedis for a cycle or IVF.
65?
Yeah, to about 80,000. That's been very conservative. Many places around 70, 75,000 Ghana cedis.
The IVF alone?
Yes.
And I know people have done it and it's failed.
Exactly.
They have to do many more in order to be successful.
Good.
So you're saying, for even one, 65 to
about 85,000 Ghana cedis is what it's going to cost you.
It's a lot of money.
It's a lot of money. And it's because it's private investment. A colleague was just trying to set up his center this week. They got a quotation. The equipment alone that he's going to buy is 42,000 euros. Just to set up.
Okay.
And all the
specialists, you need training and everything.
Yes. And this is just the equipment coming in. And the consumables are all imported.
Okay.
The drugs, the gases we use to freeze the eggs and sperms like that are all imported. And so the cost is not easy. So many people sell their shops, their homes. Some take loans to do this. So for the need, it is there.
Okay.
And we are not promising.
Because I was going to ask you about need until you said your colleague was setting up one.
Yes. The need is there.
Okay.
The need is there. We have about infertility rates in this country has been estimated variably, some quoting as high as 17% of the population with infertility of various degrees. And many of them require high-level services like IVF or assisted reproduction. And so there is a need. That one, there's no doubt about it. And also there's a need for training. Currently, I'm part of the trainers with the Ghana College and the West African College of Physicians and Surgeons.
Okay.
And for IVF or assisted reproductive technology, the subspecialty we call reproductive endocrine and infertility. For that subspecialty training, most of our training is happening in private hospitals.
Oh.
So they come to Kolebu or Konfanochi for the theoretical training, the lectures and all of that. But the practice have to be in private hospital because there are no government hospitals offering it.
Okay. So you can find facilities that help with the training practically.
Yeah, exactly. So if we build something like this, one main thing that's going to improve training is going to improve research. Many of our data we are using is from other parts of the country. If I don't want to go into technical detail because that's my field. But for instance, if we want to check what egg size should the egg get to before we harvest it and use it, what are the content of the egg and all of that, the data available to us is research from other countries. Because we have a public facility where this is being done, where high-level research can take place. A private person is interested in their money. They are not there for research.
I see. Okay. I wanted to ask about the Kolebu thing.
Yeah.
But before we do that, for our listeners, because a lot of people who have heard IVF and wondering what the IVF is.
Okay.
Just a simple explanation, then I'll go to the Kolebu issue.
IVF, in simple terms, is what we call test tube babies.
Test tube babies.
So for some other reason, a man and a woman are unable to make a baby through the normal way of, that is the normal way that we know, which is that they would have an affair and then the woman will get pregnant and then deliver. Some people, due to ill health and other problems that they may be born with, are unable to do that. Which means that we either have to take the egg out of the woman, take the sperm out of the man, fertilize it outside of the human body, and then take it back and implant it into the woman. That is basically what we call the in vitro fertilization.
You're saying there are many Ghanaians who are doing this?
A lot. But the cost is the challenge for many people.
The amount you mention a lot.
It will put people off. But you see, if you've suffered this stigma in this our society, in society where children are adored, people will go at lengths. I have seen somebody that sold, he had 4 shops in Makola, he sold 3 to do IVF.
3 or 4 shops?
Yes.
To do IVF?
Yes. And people have taken loans. People have stopped church because of being ostracized because of infertility. So it's a very serious social stigma. It's something that we shouldn't take lightly.
Okay. Now, let me come to my neighbors.
Yes.
We're not too far from us. They are our neighbors. So, Kolebu, you said you convert it into what?
We want to upgrade it to the level of a quaternary hospital.
A quaternary hospital. So what would you do to Kolebu? Because Kolebu is one of our, even with this state, and if you look at some of the infrastructure, sometimes you're like amazed that some of those infrastructures still exist at Kolebu. Is one of our most prominent hospitals.
Yes.
So what would you have to do to Kolebu to make it a quaternary facility?
All right. So if you look at Kolebu, the story of Kolebu is almost like the story of Konfanochi.
Okay.
But Kolebu is much older.
Okay.
Kolebu is 101 years old now. Right?
Yes.
And we have buildings there that were put up during Gorgesbeck's era. in the 1920s and 30s that are still standing. Some with renovation, some struggling. In fact, my department where I used to work, the maternity department, very old building that has been gone through a lot. I mean, sometimes when you are there, you are even scared because you see the cracks in it and you are wondering. Then there are services we cannot offer in Korle Bu, but we have the skill. So sometimes we have to go and offer it outside of the outside Korle Bu in private facilities. So Korle Bu needs a major overhaul in terms of its infrastructure. We did some. This current government is doing some because they acknowledge the need. So for instance, you see that they have just built a nephrology center that has been on the drawing table for years. It never started now. It's been on the drawing table for years. Maternity block has been on the drawing table for years. Sometimes awarded and the contract cancelled, re-awarded, cancelled, till now. So the services that Korle Bu is supposed to offer, infrastructure limitation is there. If you come to equipment, there are major equipment limitations where some theaters cannot run optimally because they don't have the requisite equipment, right? Minimal access surgery in some departments are happening. In some departments, a huge challenge. So we want to look at the infrastructure of Korle Bu. We want to look at the equipment of Korle Bu. The last time Korle Bu got major equipment was when we did a national medical equipment replacement program under the erstwhile Mills Mahama administration. Korle Bu got CT scans, MRIs, fluoroscopy machines from that time till now. There hasn't been any such major investment. So, and to run as a quaternary hospital, you need this kind of level of investment to be able to get there. Konfanochi, the revered chief himself said the hospital is sick and he wants to heal the hospital and launch major fundraising to try and heal the hospital. So there's no doubt that the need is there. And so it's a well thought through program to make sure that these hospitals get their facelift. And in Korle Bu, everybody who has been to Korle Bu or works in Korle Bu know that almost all our major department needs this facelift that I'm talking about. Yeah.
There are still, when it comes to infrastructure, and what you have said alone, the things you've put forward alone, those are significant infrastructure developments.
Yes.
But in the first term of former President Mahama, one of the things he did was to do a lot of CHIPS compounds.
Yes.
So which means that whilst you're thinking about big hospitals, you must also be thinking about accessibility to people in small communities.
Exactly.
Are you thinking about that in the polyclinics and the district hospitals?
Yes. So there is a plan to complete some 1,200 CHIPS compounds that we wanted to do at the time that we didn't finish.
Okay.
At the first time, His Excellency had an ambitious target to improve the total bed capacity by 6,000 beds in this country. So that's what gave birth to the UGMC, the Tamale Teaching Hospital Phase 1, the Bolgatanga Regional Hospital, then the Eurojet projects. All those were to make sure that we improve the bed capacity.
Okay.
And then he was mindful of the lower cadre of health. He thought of the health CHIPS compound and we're able to complete over 1,260. Okay. There's a plan to complete another 1,200 in various communities. And then coupled with that is one of our best promise in this manifesto in terms of service delivery and healthcare financing, which I haven't got into.
Okay.
But in terms of healthcare financing, we said we're going to make free primary healthcare.
Yeah.
This is something that has been well thought through.
Okay.
In the short to medium term, first 2 years, we expect that all CHIPS compounds, health centers will be free.
Okay.
When you go there, and we've costed how much on the average these facilities spend in a year. Okay. And there is basis for this assessment. It's just not made in vacuum. If you look at it, we know that these facilities are not well catered for in terms of NHIS accreditation. Okay. I'll pull up some quick figure for you. So if you look at the free primary healthcare policy, the reason is this. Less than 23% of persons living in rural areas have access or have active NHIS cards, right? less than 23%.
Okay.
So the figures they give you is a global figure, but when you disaggregate it and go into the rural areas, you realize that there are people there who are lacking access. Now, and less than 45% of CHIPS compounds are accredited to deliver NHIS services.
Okay.
So if your CHIPS compound is not accredited, what it then means is that all the people in that community, you cannot use your NHIS card there. But the truth is that, so now you will know that you and I, whether you have an NHIS card or not, you're contributing to the NHIS.
Yeah.
But the bulk of the money of NHIS is not from the premiums. It's from the levies.
Yes.
So why are we all contributing and some people are denied? So His Excellency have thought through all of this and said that, look, to help us achieve universal health coverage, which is a goal of the WHO, let's make that level completely free, whether you have a card or not. So we are putting up 1,200 more CHIPS compound and then making the service at that level free.
Okay.
And it's just cost about 150. That first 5 years is not going to cost us more than 400,000 Ghana cedis to do. 400 million Ghana cedis to do.
400 million.
Yeah, to do.
Okay.
Yeah.
And the funding will be from National Health Insurance or how?
Yes. So the National Health Insurance, we have thought through everything. One of the source of funding will be the National Health Insurance Fund. And someone will ask how we get that funds ready. One of the cardinal sins, and I've been singing this on a lot of platforms. I'll sing it here on your platform. One of the cardinal sins that this government did to the people of Ghana is the capping of the NHIS.
Okay.
So the National Health Insurance Fund, where we have all contributed our levies, the fund was set up to cater for our healthcare. Immediately this government came into power in 2017 in April, they went to Parliament to pass an act called the Capping and Realignment Act.
Yes.
That puts several statutory funds into this capping regimen, and they capped it at 25%. So all the monies that will come in, they were not going to disburse more than 25%. As if that was not enough, they reviewed it later and capped it down to 17.5%. If they continue in power, maybe they may bring it down to 5%. Where money meant for the health care is gone into the consolidated fund and explains the struggles of the National Health Insurance presently. So that money is not disbursed timeously, and it's not all is released to the NHI. So once we uncap, a lot of money will be made available to the NHIs. We can increase the allocation to primary health care. And we've said that we are looking at making sure at least 20% of the uncapped funds will go to the primary health care. So that free primary health care policy can then be financed by this. So ordinary people living in that place can have access to health care. But as you go higher, the district hospital, tertiary hospitals, then your card is needed to help you. So people will still be motivated to get a card, because if you are referred from these facilities to a higher level, you will need a card. So it is enough motivation to get a card. And the uncapping is also going to make releases more timeous and also pay realistic tariffs. So if you are a medical practitioner, you will know that one of the problems that people go to the big hospitals, like the teaching hospitals, basic labs, like full blood count, you go and they'll tell the NHS doesn't cover it. You go and buy a basic drug and they'll tell the NHS doesn't cover it. There's an explanation for this. And the explanation is that, so I buy reagents worth 20 cedis to do a test. And the NHIS is paying me a bundle, of which, if you look, maybe the test component of it is 5 cedis. Who would do that? It means that you're going to run at a loss. You buy a drug worth 15 cedis. The NHIS has pegged the price of that drug for 10 cedis. No private practitioner will sell that drug on NHIS. So they will tell you it's not available on NHIS. Because even when they sell it to you, they'll say they are doing co-pay. And then it's illegal. So they'll tell you it's not available. And you have to go and buy it. And this is one of the fundamentals, because it's not paying realistic tariffs. So NHIS have, if they have more money to them, they can review the tariffs regime so that they pay realistic tariffs, so that people, the card then will make sense to people. and more services. So they are saying we are covering more diseases, but in a lot of it, it's just a scratch on the surface because they are not paying realistic tariff for it, and therefore the providers are making sure that some component of it to stay afloat, they don't put it into the NHIS. And it's just health economics. But if you don't do that, you won't survive. So that free primary healthcare policy is well thought through. First 2 years, we are looking at the chief's compound. In the second to third year of His Excellency's reign, then we'll look at upgrading to the level of the polyclinics.
Okay.
Yes, and that is where the primary healthcare will end.
Will that not affect the sustainability of the NHIS?
Never. It will rather make the NHIS strong.
As you speak currently,
yes,
the NHIS is struggling to pay claims.
And I've told you why.
Okay.
Because somebody has capped their funds and is taking that money into consolidated funds and is using it however they wish. That consolidated fund, when money goes into it, I don't know who will be able to tell what happens to that money. But really, it's a cardinal sin that I contribute money, right? That when I'm not well, it should take care of me. And you put that money into a common fund and used to run things like government machinery, office of the president. Really? Was that what I contributed for when I paid the levy? I don't think so. So I think, the District Assembly Common Fund was added and they went to court. Our parliamentarians took it to court. The NDC took it to court and it was expunged from the Capping Act. Unfortunately, the way the NHIS Act was couched, there's no legal basis to go and fight for it to be released. But on moral grounds, it is unacceptable to cap the NHIS fund because we cannot contribute for our health. And then you take that money and put it in the central fund and use it however you wish.
Look, our time is up, but I want to conclude on one note.
Okay.
Now, this is Wills Bonnie from Sweden.
Yeah.
So I personally know a doctor at the Kolebu Teaching Hospital who I had a chat with just last week. Said to me he's making some moves to leave the country. Apart from him, I know a doctor and a nurse at the Komfanoche Teaching Hospital and a nephew's wife who are all planning for same. I also know two nurses, one in training currently, and one who has, in fact, the very first day she went into her clinic, she became the lead nurse. And she's been there for about 5 years or more. Now she's also planning to leave. There are many more people planning to leave. To what extent does your manifesto address this issue? What's the proposal?
Okay, so we have some solid proposals. Because time is up, I'll summarize them briefly.
Okay.
So we said that we are going to look at the living. See, migration is governed by laws.
Okay.
You cannot forcefully stop someone from living.
Okay.
If you improve the economy, restore hope in the country, some people will decide to stay. Those who want to go, we want to create a very good migration policy so that when they leave, the government and Ghana, the people of Ghana, benefit. The other reason why people are leaving is that there's no motivation. So we are saying that we are restoring and the vehicle waiver for healthcare workers, some categories of healthcare workers, in a very regulated manner.
Okay.
It was stopped because it was abused. Okay. We brought a vehicle revolving fund, it was abused. Now we want to bring the waiver in a very regulated manner. We also say that even we don't just want them to stay, but we also want to distribute them equitably in the country. And for that equitable distribution, His Excellency says doctors, nurses, pharmacists, all people who agree to work in rural parts of this country, underserved part of this country, automatically they will get a 20% of their basic salary as a top-up allowance for them. Not only that, they will have promotions out of term. What that means is that if somebody working in Kolebu who can do locum around and everything will need 5 years to be promoted to the next rank. If you serve in that rural community, you may be promoted in 2 or 3 years. Then if you need to go to postgraduate training or study leave, you will be granted earlier than the people in the cities. This is all to make sure that people agree to accept to go and serve in such communities like mine. When I mentioned in Lambusie, as of today, there's only one doctor shuttling around. So if a policy like this is there, people will be willing to go and serve there because they get opportunity to go to school quicker, they get to rise quicker, then coupled with our training, many more will come out. But our main policy is that improve the economy, improve the livelihood of these doctors, nurses, and other healthcare workers so that they'll be motivated to stay. Because remember, as I mentioned, it is not an issue of postgraduate training anymore. If it was an opportunity for training, a lot would have been staying, because now we are doing a lot well in the training in this country. There's lack of hope in the country. Change in power alone will restore hope.
Okay.
That alone will tell people
Change.
that the change alone, that Ghanaians can be angry enough to punish leaders who mismanage the country. The corruption scandals, if this government goes unpunished, what we are telling anybody is that you can do anything to the resources of Ghana and we'll reward you by retaining you. You're right? And anybody who can reason at a certain level will realize that there's no hope in this country. But if people will be punished for wrong deeds, first by being voted out, so that we show that people can get angry enough to show that at the ballot box, that is a statement to any budding politician that never take the people of Ghana for granted. If our operation Recover All the Loot comes in, we're able to recover some money from people who have stolen from the state. It gives hope to people. If you're able to manage this financial crisis well, so that people have some confidence in the banking sector and invest for the future, then people are willing to stay. Because when we all work, we don't know what will happen to us when we are old. And if your investment can just be taken by someone one day and the person will tell you, I will not give it to you, you go and picket and bleed in the sun and they will not even mind you, then really, why would anybody stay here? So I think all of this will restore some hope in this country, and many people would love to stay. I tell you, those who move, they're not happy moving more. At that level of migration, nobody's happy moving. You have kids, you have wife, husband, you have started some business here, you've built, because this level, we are looking at people in their 40s who are going out. Many of them would have loved to stay here and enjoy serving their own people. But the state of hopelessness is the number one driver of people moving out. And so once His Excellency comes and reset this country, that's why I will conclude by saying that anybody who says an upgrade of this country instead of a reset, that person, I don't know what to say. But if you upgrade thievery, you get corruption, you get armed robbery. If you upgrade thievery, maybe you get armed robbery. If you upgrade this level of corruption, I don't know what we will get. If you upgrade this level of nepotism, I don't know what we will get. You can only upgrade something that is good so it gets better. You don't upgrade something that is bad. If it is bad, you reset it on a different path. And His Excellency wants to reset this country on a path of prosperity and shared growth. Not where one family alone gets well. Not where there is an Ajapadia document that is being implemented, a mystical document that is being implemented to ensure the dominance of one family. We mean Ghana should be for everyone. And for everybody who is disgusted at all of this, you have one opportunity, which is just 79 days from now, on the 7th of December. Vote for the NDC parliamentary candidate in your neighborhood. Vote for His Excellency John Dramani Mahama, if for nothing, just to demonstrate your anger and to show any politician, thousands of years to come, that some time ago in the history of this country, there was a set of leaders who decided to loot the country and they were punished. If we end up with a parliament where out of the 275, maybe 200 is for NDC, and they lose a lot of their seats and they perform poorly, it will be written in the history books and everybody will know that never take the Ghanaian for granted.
Prof, it was a pleasure having you in the studio.
Thank you.
And I wish you all the best in your pursuit in Lambusie. In fact, it's lovely to see people of your quality walking into politics and providing your expertise. Professor Titus Beyuo, I can start to list them, but anyway, he is the parliamentary candidate of the NDC for Lambusie and also a spokesperson for the NDC on the manifesto on health. Next time you're in town, please let us know, because we haven't even talked about the pandemic areas and many other things in health that we haven't had a conversation on.
I'll be glad to be here again.
Yeah, it was nice. It was nice listening. Well, all hail the Queen.